Healthcare workers say they've over time experienced the deteriorating state of health facilities. They want to see change, rolling out a service delivery campaign that will hopefully unlock funding and see the plight of these facilities addressed. Public sector workers belonging to NEHAWU are demanding better circumstances. They say the sector has experienced unprecedented times that have hampered the delivery of essential services.
We are the slaves of this hospital. So sonke nje abantu base health, we are not healthy.
Lack of money, short of staff, the conditions that members are working under is not conducive to work.
We would appreciate it if our employer go back to his thoughts regarding the negotiations.
The workers demonstrated in Gauteng and the Eastern Cape province calling for change.
There's always a song in the public sector that the government does not have money. It's always a story that we hear. But you really cannot, let's take for example the health facility as big as this one. You cannot really be giving it the resources equivalent to when you had a lesser population.
NEHAWU forms part of Federation COSATU and has around 275,000 members working at healthcare facilities across the country. The COSATU president called for workers to be unflinching in their demands as their lives and those of the public depends on it.
It's going to be important that as we launch this campaign, we make sure that our voices are amplified before the 22nd of February. Whatever that the minister would have been prepared, kufanele kwazi amend because of this campaign.
In the Eastern Cape, the Healthcare Department acknowledged the challenges faced by this sector, mostly involving dilapidated infrastructure, and says interventions are well underway.
At the beginning of this current financial year, the MEC did give instruction to the HOD saying, HOD, we cannot afford to continue folding the chairs, and instructed the HOD to ensure that the administration finds the money so that we employ people. As a result, 710 million rands was found to employ 2,941 people.
These patients have lauded the launch of the service delivery campaign, saying this will hopefully enhance their visits to healthcare facilities.
They closed the hospital, then we had to go to Byron, then we went for the first treatment. The second treatment, they told us, no, Joe Jen says we must come back to them. And they didn't inform us. So you can imagine, we went to Byron, okay, we asked Byron, can't you give us? They said, no, we can't give you our treatment. Our budget is going to be strained.
Hey, brother, hospitals need to do something about these long queues because you wait here while sick and it takes forever to get service, and nurses must also treat us well.
We can see that we can get a canteen, at least seeing that we're here 5 o'clock in the morning to have a cup of coffee. I think that's the only problem that I've got, and the parking must come right.
Health workers describing the launch of this service delivery campaign as a message to government to do better by the sector. They've taken issue with the lack of funding. They're now looking to the budget speech to come through with the finances that will ensure the health sector, the life of patients and that of healthcare workers is not compromised. Gauteng, SABC News, Johannesburg.